Hey everyone, it's Dr. Andrew Orr here. Today, what I wanted to talk about on this post is basically the danger of waiting too long. The reason that I talk about this is that over the last couple of weeks, and even today in general, I've heard about the consequences of waiting too long to go and get help on certain things. Even today, I've had a couple of people that have come in to see me and they've waited too long, and then we've found out that there's cancers and things like that, and everything from ovarian cancer, and they've put things off way too long and haven't been prompted, or they have been prompted to go and seek help but just haven't done it. Also, I was going to talk about this a few weeks ago because recently we've had a few deaths from the influenza virus. Now, this is always a point of contention because every year we do lose people from the flu, but what generally happens is that people wait at home, or they'll go and see their GP or stuff, and then they get sent home with stuff, and then they actually get worse. And because they've already seen the GP, they don't want to then make a fuss and go and do anything further about it, and then they suffer. And often they're actually in a lot of pain. They're on a, they're really struggling, and for them to then, when they do finally get taken to hospital, it's all too late. And the part of the reason I'm talking about that too is because of my own experience. About a week ago or so, I was suffering with a lot of pain too, and I went and saw my specialist, and he said to me, he goes, "You've had this for a little bit longer than a week," and I said, "Yeah, I have. I've had it for a couple of weeks now." And then he goes, "Yeah, I thought so." He said, "The problem is," and he said, "you'll see this with your own patients, is that because you're so used to pain, you've got a really high pain threshold, you put up with a lot more than other people." And I said, "Yeah, probably. But after then speaking with someone and doing the right things, then you can get on top of that pain management and get right treatment." And I got on, of course, antibiotics and things like that. Now, what I'm trying to say to people is I often see a lot of people with things like endometriosis, adenomyosis, and all kinds of things, from chronic pelvic pain, all sorts of pain, that are trying to manage their pain on their own. And when you're getting over that 5 out of 10 pain and heading up to that 9 out of 10 pain, that means you're not being managed very well. And that means that you are now at a point where you're critical and that you need some form of intervention and some form of help. Because if what you're taking to, say you're on a pain management plan, or you're on just, a lot of people get given a lot of pain medications and then go away and self-medicate too, it means you're not being managed well. So that means that you then need to go and get some help. And a lot of people don't go and get professional help. One of the other things I hear too, and I've talked about this in previous posts, that a lot of people don't go to the hospital too, because if you're in that much pain, you probably need stronger than just oral medications. You might need IV pain medications, and then everything's settled down. But a lot of people go, "Oh, I just go to the hospital, I don't do anything." If you had an accident emergency and you're in a lot of pain, I doubt highly they're not going to do anything, because that's what their job is. But what a lot of people seem to think is that they're going to cure their illness at the same time. That's not their job. Their basically job is to get you out of pain, find out what's going on, and then refer you, and then follow-up care to other practitioners. And that might mean going back to your gynecologist or your regular specialist, or within the public system itself and things like that. That's what their job is. So it's about that expectation as well. So I've done a post on this before. Have a look on it about emergencies and stuff like that. I think a lot of people don't recognise, and I do understand that some people get turned away too, which is disgusting. And I've heard people, saying, "Oh, they're just prescription junkies" and stuff like that, and that's what they're here for. I think that's a little bit disgusting. And if that does happen to you, you need to make a complaint via the hospital. There are complaint processes and stuff like that. But I wanted to just mainly talk about the reason of not waiting for things, because the longer that you wait, the further things can happen. Like for my instance, I had an infection and it got worse and worse, and the pain levels were getting worse and worse and worse. And then that's harder to treat because basically soldiered on trying to get through work, and that's what some of us do. We get up and just soldier on every day, as many of you could probably understand, but it's not good either. And it just, through my own challenges, it brings to light. And then, like I said, you know, hearing on the road people have died, you know, they've waited too long, and you can tell that's what's happened. They've waited too long, and it's not their fault. But what I'm trying to bring light to is don't wait too long, because the longer you've had something, the worse it becomes, the harder it becomes to manage. Long-term chronic pain is really hard to manage because it's been left way too long. And then, you know, then when pain becomes unbearable and unmanageable with medications, then it might need surgical intervention. Now, hopefully you don't end up at that point, but that is what surgery, when people then have to end up surgery, that's why surgery is performed, because that's all that's left. Because we know despite best medical intervention, people are still in pain too. And this is why after your pain's managed, then you have to keep it managed. And this is where you do the multimodality approaches of seeing different healthcare practitioners to basically manage your pain and your disease state and whatever you're going through properly. But make no mistake, you can't do it on your own. You've got to have proper care. And yes, you can get some of that care through things like public systems. It's not as easy as through private, but private does cost. And I understand also that not everyone can afford private care, but there are avenues within the public system, but you just have to be very proactive with it, and you have to know how to work the system and then be involved in the system. And you've also got to steer the boat a little bit yourself as well. I hope that's helped some of you tonight, but please, if you're sitting at home in pain, it means that you need to do something about it. It means you're not being managed well, and don't put it off too long, because those symptoms that you think might be just your normal symptoms might not be. Like I said today, I had someone come in with ovarian cancer, and it's now spread or, you know, to other parts of their body because they'd left it too long, and they were told not to, and they just did. They just soldiered on. Yeah, so now the chances for that person are relatively low. So don't put off. Don't put off. It's better to go and someone say, look, check you out, and go, yeah, you're fine, blah, blah, blah. There's nothing sinister there, because there can be sinister things there, and things can happen very quickly. You know, things can grow very quickly, like cysts and all that can grow quickly. Things can develop very quickly. And people can go down a hill very quickly, like we've seen with influenza and that, and end up in comas and all kinds of things and then die. So please, don't try and manage yourself. Don't try and take advice from friends or whatever. Go and see proper healthcare professionals. Take care, everyone. Hope everyone's well. And yeah, just remember there's always help out there.